As Russia's attack on Ukraine enters its second month, we wanted to try to learn more about kidney care, particularly for people on dialysis or who have kidney transplants in a war zone. I'm pleased to be joined by Professor Serhan Tuğlular, a member of the European Renal Association's Council. Professor Tuğlular also chairs the ERA task force responsible for supporting patients and health professionals affected by the war in Ukraine. Dr. Tuğlular is a professor of nephrology at Marmara University's Medical School in Istanbul, Turkey. Thank you, Serhan, for joining us today.
Thank you for the invitation, really.
I thought we'd just start, I'd really like to get some insights as to the discussion among the ERA counselors about establishing the task force. What was it you were trying to accomplish?
Well, European Renal Association has been certainly deeply concerned about the current war in Ukraine. Wars, wherever they may be, is certainly a major threat to public health, really. I mean, from infrastructure, sanity, access to food, water, medical care, it may all be disrupted. And in the midst of all this, turmoil, kidney patients are even more vulnerable. I mean, dialysis patients have only about 72 hours or so to cling to life. Dialysis centers need electricity, water supply, as well as dialysis materials to function. Furthermore, patients need to be able to access to these centers. So, on the other hand, PD patients, for example, peritoneal dialysis patients, need to have their solutions, need to have hygienic setting to perform their dialysis. Then we have transplant patients who need to take their medications regularly and timely. So this list would, of course, go on to include all individuals with diabetes, hypertension, CKD, systemic diseases, etc. So all these patients need to have access to both to their medications and medical care. Then, of course, in this group, we also have acute kidney injury patients, also of concern, gunshot-related bleedings or crush and other injuries, exposure to noxious gases or agents are all a problem during the war situation. So war is not only general public health problem, but also a further threat to all these vulnerable individuals, really. So I think it's very understandable why European Renal Association has been really deeply concerned about the kidney community in Ukraine since February 24, when the invasion by the Russian army started, really.
What was the first step the task force took?
The first steps taken were kind of an immediate reaction. A declaration of support was announced, following which a mutual statement of the three major nephrology associations, namely ISN, ASN, and ERA, was made. So obviously, kidney community was deeply concerned about the whole situation. Then ERA tried to reach out to our colleagues in Ukraine, to doctors Mikola Kolesnik and Dr. David Ivanov, who are presidents of adult and pediatric societies of nephrology in Ukraine, respectively. So then in the council meeting, the council thought that to efficiently really support the kidney patients and nephrology community in Ukraine, starting a specific renal disaster relief task force would be more appropriate for the organization, collaboration of all the partners in this, really. So actions were immediately taken, and I really stepped in to be appointed to this task force.
Why did you volunteer to chair the task force?
Why I was perhaps personally interested. We live in a country of earthquakes in Turkey. And in 1999, we had a major Marmara earthquake. And from then on, we knew that renal disaster task force was very important. In fact, When I look back, one of my aims in being area council was really to work in this. So I thought I really would like to take part in this. But then, of course, the other members, the members of the task force, we reached out, and I must say they were very kindly and very enthusiastically accepted the invitation.
I guess my next question, which I really would like to hear your answer, is who are the other members of the task force?
Most are, really distinguished nephrologists from Europe. So first, perhaps I must mention Dr. Raymond Van Holder and Dr. Mehmet Şükrüsever, who have ample experience in renal disaster medicine, really. Ray actually coordinated and took part in several disaster relief operations in collaboration with Doctors Without Borders. He actually coordinated the renal disaster relief task force of the ISN. Then Mehmet Şükrüsever also, starting from Marmara earthquake, was a volunteer in Médecins Sans Frontières, and he actually went to India during the earthquake, Haiti during the earthquake there. So he served actually as a field doctor and disaster relief coordinator in many mass disasters. And they really have ample experience and contribution to literature. So they were like advisors in our task force, and very actively, not only like advisors, but actually actively contributing to the task force. Then we have from neighboring countries, Ionuț Nistor from Romania, Andres Coberne from Slovenia, and Andres Licek from Poland. They, being in the neighboring countries, they are really seeing about refugee patients, how they are treated, how many arrive, how they are received, etc. Then we have Valerie Lusix from Belgium, who is also a renal disaster expert, I could say, during the earthquakes and many disaster conditions. He also worked for ISN as well as for the World Health Organization. Rukshana Shroff from UK, she's a pediatric nephrologist and communicates with the pediatric community. Anybody I have forgotten, I think, and Kai Yue Eckart from Germany. He also is from Charité in Berlin, and they are also accepting patients, not very many at the moment, but he is also a member of the team. We also have Daniel Gallego representing the European Kidney Patients Federation. And lately, two nurse colleagues joined us from European Dialysis Transplant Nurses Association, Anna, Chris, and Edita Lulisliena. So our group consists of these names.
I'm really struck that so many of the people involved have also experience, as you had mentioned, in terms of your experience with the earthquakes in Turkey, with disaster relief, and the fact that in emergency response, and the fact that the kidney community in some ways is uniquely positioned to be helpful in these types of unfortunate situations because of our experience with earthquakes and hurricanes and other natural disasters. In terms of the war in Ukraine, I'm curious, as you look at the situation on the ground, particularly for people with kidney diseases and those on dialysis and with transplants, what's the situation right now? How would you describe it currently?
Well, we had a meeting last week on Tuesday with inviting all the, stakeholders. So we obviously had the task force, but we had Mykola Kolesnik and David Ivanov from Ukraine. We had two representatives from Ukraine Ministry of Health. Then we had also Dr. Slim Slama from World Health Organization and a member from Médecins Sans Frontières, again, Doctors Without Borders, also joined us. And we as well as members of the representatives of the dialysis industry. So Fresenius Medical Care, B. Brown, Davita, Tod Ibrahim are the ones that I can remember now. I think that was all. And this actually gave us a full picture of the field. Because, of course, Dr. Ivanov, David, and Mikola Kolesnik gave us information about the centers. There are about 9,000 patients treated for hemodialysis, 850 PD patients, and 1,800 renal transplant recipients in Ukraine. The majority was in Ukraine. This was also the information that we received from the industry, from the Ministry of Representatives of Ministry of Health, as well as our colleagues in the neighboring countries. So patients felt still more secure. They didn't want to leave Ukraine. The other thing is, at the moment, most of the dialysis units are operational. So we thought beforehand that they would have difficulty for functioning dialysis centers. Whereas the information, at least for the moment, was that dialysis centers did not generally have many problems. About 94 Ukrainian centers now are providing hemodialysis, providing dialysis 2 times a week, which is indeed an option that one can use in disaster situations. And also encouraging patients, for example, to take more care of their diet from fluid, electrolyte point of view, etc. With that, you can actually decrease the number of dialysis sessions per week. So that's how they were doing it. Then, of course, apart from this, there were still Fresenius Medical Care had 3 dialysis operating in Ukraine. So actually, they had to close 2 of them because one was bombed and the other one had no water and electricity supply. So they collected all their patients to the 3rd center in Cherkasy, which was the 3rd center. Again, the dialysis industry, confirmed that the supply chain was continuing. So, all partners, all stakeholders, Ministry of Health, our nephrologist colleagues, and the industry said that actually at the moment, dialysis could be continued, hemodialysis meaning. But what they lacked really were medications. So heparin, which is very important for hemodialysis, obviously, iron, IV iron, erythropoietin stimulating agent, and then also, of course, most importantly, immunosuppressants for the transplant patient. And this goes on, of course, for antihypertensives, for medications, insulin, for diabetes patients. At the moment, they had some supply, but thinking of, for example, the next 2 months or so, they think that they may be short of that. So I think that's the main thing. That's the main message that we got from our colleagues in Ukraine.
It's interesting because one of the things you didn't mention is acute kidney injury. And I know usually in disasters, particularly disastrous war zones and earthquakes, that's a real challenge. So what's happening in Ukraine in terms of people who had healthy kidneys that were then victims of the war and the sort of level of acute kidney injury?
Oh, thank you for asking that. Indeed, that was something that we brought up too in the meeting, and Dr. Kolesnik very specifically said at the moment they had about 20 acute kidney injury patients, and they were all due to not war-related causes, due to cardiac surgery, due to sepsis, that would normally occur, that may occur in these patients. So at least for the moment, he wasn't aware, he didn't have information about war-related AKI patients.
So I guess my next question would be around refugee patients. So because so many members of the task force are in countries that border Ukraine, what's the situation for people who've left the country but either have required dialysis, have transplants, possibly have AKI? What's happening with the refugees?
First of all, one of the very important points that all the task force members said, at the same time, mutually, and also supported by Dr. Kim Slama from World Health Organization, who is the head of the non-communicable diseases in World Health Organization. Actually, the EU, European Union, Temporary Protection Act was put into action since February 2022, ensuring free of charge treatment for all patients from Ukraine in EU. Now, this is very important. So in all the countries, or in all the neighboring countries, Poland, Romania, Slovakia, Hungary, Czech Republic, as well as Moldova, which is not an EU country, in fact. All these patients, all the refugees, our health expenses are really treated free of charge, let me put it this way. So we actually, in our first task force meeting, before meeting our colleagues from Ukraine, we thought the best thing would be evacuating these patients and kind of, draining them to the neighboring countries and to the EU countries where they could be safely under these circumstances, have their medical care. But despite this, and we actually, proposed this, writing a letter to the Ministry of Health before our meeting, actually patients were not willing to be transported to the neighboring and other EU countries. So all those who have immigrated in the first 2 weeks, which was about 200 patients or 300 patients at most, and they were distributed between the neighboring countries. So at the moment, our colleagues from the neighboring countries say that there is an overwhelming influx of patients. So they are ready to undertake the medical care of these patients, but these patients are still mainly in Ukraine.
So you started to answer my next question a little bit earlier, and I just want to be very clear, because as you can imagine, the American Society of Nephrology, its members are asking how they can be helpful. And so as you think about the nephrology community outside of Europe, such as nephrologists in the United States and patients in the United States and other health professionals, what can they do to help you and your colleagues in this effort?
Thank you again for this question. At the moment, we also asked first of all, doctors can work as a doctor in Ukraine, of course, only with the permission of the Ministry of Health there, plus only through perhaps Doctors Without Borders. But Doctors Without Borders, Médecins Sans Frontières, also have specific rules, regulations, and we actually approached to them asking if they needed us to volunteer and to work with them. But at the moment they said that they didn't need, they weren't really deploying nephrologists. to work in Ukraine. So, and also our colleagues in Ukraine said, they didn't need additional nephrologists to work with them. So at the moment they were managing, but we are in constant communication. And of course, this is a dynamic process, dynamic time, and things may change. So I would suggest that they really, watch closely from the news from the kidney community to see if the situation changes. Other than that, it's really what they need is medication. So collecting these medications and perhaps trying to deliver them, and that we can also discuss how to Ukraine may be an important aid. But I must also say, all our Ukrainian colleagues, represented by the societies and also the Ministry of Health, they were very thankful, very resilient, and hopeful, and very well organized, I must say. We were all very impressed.
So you mentioned that there are ways for us to coordinate our response. And so in terms of if we were to try to provide medications for people in Ukraine, particularly those on dialysis or with kidney transplants, how would you see that working?
The representatives of the Ministry of Health, I think her name was Alexandra Mashkevich and Vasily Strika, they really said that they had a health hub. It was called Ministry of Health Hub, and they actually Ukrainian humanitarian hub, and they said that all the humanitarian aid should be directed to the Ukrainian humanitarian hub. The actual delivery may also be through Médecins Sans Frontières or World Health Organization, or through our colleagues in the neighboring countries. For example, Ionut Nistor from Romania managed to send parcels to Ukraine. Every week he is doing now. So if they reach out to us with the medications, if they have collected the medications, we would be very happy to direct them to the right people, really.
Well, thank you. Let me see if I can summarize the discussion we've had, and then I'll give you the last word, of course. So the European Renal Association is coordinating the kidney community's response. At this moment in time, it sounds like most kidney patients, including people on dialysis, do want to stay in Ukraine, and there is an organized and currently successful effort in terms of to be able to support them. The absolute biggest need at this time is for medications, and there's a number of different options, including the Ukrainian Humanitarian Hub, the World Health Organization, Doctors Without Borders, and nephrologists in neighboring countries where we can get those medications to the people who need them in the war zone. And you and your colleagues on the task force will let the rest of the community know if there's anything else you need. Is that a reasonable summary? Is there anything you want to correct or add to what I just said?
Yes, very good. As I said, this is a dynamic time, really. So things may change if the war really continues. So although at the moment there are not many refugees, the number may increase. So the one thing that I'd like to add, the representative of the Ministry of Health said that they were actually preparing a list with the World Health Organization, so as though, and the people actually knew about the conditions in EU countries, but if they wanted to immigrate, if they wanted to be a refugee in the other countries, their names were put on the list so that they can be transported through the border. So that's, I think, one thing that I forgot to mention previously. I must really say, I mean, they are doing a very great job there from, and our colleagues in the neighboring countries, Dr. Vicek from Poland, Ionot Nistor from Romania, Andres Skoberne from Slovenia are in constant communication. And they're especially collecting information about all these refugee patients. I am very much impressed, though, with our colleagues in Ukraine, I must say. Their resilience, their hope, and courage.
Well, Professor Tuğlular, thank you very much for everything you're doing, for taking the time to talk to us today. But also, I think your final comments about the resilience and of the community, both the nephrologists and the other health professionals, but particularly the patients in Ukraine. Just again, thank you for everything.
Well, thank you for giving us a chance to reach out to members of ASN and kidney community. Thank you.